Today's healthy living adventure takes us over to the Surgery Center of Pinehurst. We're at Pinehurst Hip and Knee with Dr. Jason Guevara. He is a board-certified orthopedic surgeon, and we specialize in knees and hips, and we're going to talk a little bit, Doc, about arthritis today to start. What is arthritis, first of all?
Well, arthritis is simply the meaning, if you look at it, is arthros is joint, itis is inflammation. So it's nothing more than joint inflammation.
Okay, and if left untreated, this can grow into bigger problems, snowballs into more and more pain, and then actual physical debilitation, and we just get worse from there.
Oh, absolutely.
Okay, you have some models that you're going to show us to illustrate the progression of the arthritis.
Right. Let me just use this knee model here. If we look at inside the knee here, the cartilage is blue in this model. So it's on the top and the bottom. This is the femur and the tibia. The meniscus is the white part. So this is like the little cushion in between here. But on this model here, we start to lose some of the cartilage, like little chips, a little wear and tear. So a lot of times when people have a little ache and inflammation in their knee, it could just be a little wear and tear off the cartilage. In this model, unfortunately, it's all the way down to the bone. There's still some good cartilage in this knee, but this is like a little pothole. It's just all the way down to the bone itself. And in the fourth model here, this is end-stage arthritis. This is all the way down. There's no cartilage whatsoever. Those three we call Arthur. This is Bob. Bone on bone. There is just nothing left in this model. There's bone spurs. The space that used to be here where the blue is completely gone. So it just kind of wears away.
Okay, so we identify how severe the problem is, and then you have different remedies to take care of that.
If it's just the very first part, if it's just a little worn and there's just little chips here, sometimes some anti-inflammatories, exercise, keeping the weight down. Every pound we have is 3 pounds of pressure on the joint. So that's the first stage. If we have a tear of the meniscus, which again is the white part, like if we're twisting here and we just kind of snap part of that meniscus and it's torn, if it's a flap, it's not going to get any better, and that flap is like an orange peel that if you keep peeling it, it's just going to rip more and more of it away. If that's the case, that piece could damage the remaining cartilage, accelerating the arthritis. So if you have a mechanical symptoms in the knee where the meniscus is getting stuck, it's better to try to take care of that. And the treatment for that would be arthroscopic, where we actually go into the knee, pluck that little piece out and take care of it. If we have a situation where it's all the way down to the bone, but the rest of the knee actually looks good. So this is like a tire. If you got one bad tire and the rest of the tires are good, how many do you put on?
One.
So we actually have that. That's what we call a partial knee replacement. So it just kind of goes back and forth. This model here is a special one called the Oxford, where it actually slides. So there's less wear and tear over time period. When we talk about how long these joints last, this partial knee lasts just as long as the total knee. So if you've worn down just one tire, sometimes it's great just to get this. Now these patients are up and walking within a matter of days, within a week. A lot of times they throw their cane away. It's amazing how quickly they recover from partial knee replacement. And yes, we can now replace the kneecap. Most of the people, when you're getting up out of a chair, you've banged your knee, you've broken the kneecap or something in the past, well, now we actually have a solution. If the entire knee is like Bob, completely worn out, you don't want to do a partial because the rest of the knee is going to hurt. So in that case, we replace all of the knee. So this is what we call a total knee replacement. So it kind of moves like this, and I'll show you a little model. So this actually goes back and forth. So it's got the perfect swivel for a golfer.
Right.
And as well as tennis player.
Okay.
So we can go back and forth this way. How we actually put it into the knee itself, for the bottom half, we actually cut just a little sliver of bone, because if it's been worn down more on one side than the other, it's kind of uneven. So we just level it off and glue on a metal tray. Then we put the plastic in between. And on the top half, We leave all the ligaments, we leave all the muscles. We do this minimally invasive. If you've got a large knee, you'll have a little larger incision. If you've got a small knee, you get a smaller incision. So we shave down all the bone so that it accepts perfectly the mate, which is the cap, just like a crown. And then it just moves back and forth.
Let me ask you, former President Clinton had a knee replacement. You mentioned Bethesda. Which one did he have to go through?
Well, he actually just tore part of the quad tendon, which is right here.
Okay.
So he tore this tendon, so this had to be reattached to the bone,
Okay.
so that he could bend his leg back and forth.
Was he a good patient?
Fantastic.
Let's talk about our hips. Move up
Okay.
a little bit. Hip problems. What causes those, and how do we identify how severe and what kind of treatment?
Well, a lot of times arthritis is hereditary. My mom's had a hip replacement. She probably needs some knee replacements. So I've got a 50-50 chance if I'm going to have one of these days. So it's just one of the things that we're either lucky or blessed to have good cartilage or not. This is a hip replacement. This actually goes into the femur. This is the ball. This is a socket that we actually squeeze into the bone, so we hold it solid. If the bone is really soft, say osteoporosis, we've got some screw holes to kind of lock it in place. So this is a traditional hip which was started in 1960.
Okay.
And we've advanced the plastic. This plastic is so much better than it's ever been before. About June of '98 is when the new plastics were introduced in the country. And I was one of the first ones to put that in. So I've got a Marine out there that's running on new plastic. But we've got alternate surfaces. This is ceramic instead of the metal because there's less wear and tear on ceramic. You can have a ceramic on ceramic liner, or one of the most advanced ones is an all metal, so there's no parts to wear out. So like if you were 50 years of age and you had a hip replacement of this type, either ceramic or metal, it's an alternate bearing joint, I would expect that this lasts your entire life. If it was metal and plastic, the plastic traditionally has worn out probably in about 15 to 20 years. The new plastics haven't been out that long. So it may be 40 years, it may be 30 years, it may be 20 years, but if I was 50 years of age and had a hip replacement, I don't want to do it again when I'm 70. I want to have it last a lifetime.
Sure.
So this model here, we can see how the stem actually goes into the femur. We just slide it into the femur, and then the bone grows in. It takes about 3 months for the bone to grow in.
So you don't need any cement in there, it just knits to it and grows around.
Occasionally we cement them if we need to. But if we can squeeze it in there and the bone can biologically have biologic ingrowth, then it's nice and solid for life.
Okay. We want to enjoy an active life no matter what your age is. So when it comes time to have world-class treatment, you can get it right here at Pinehurst Hip and Knee. And Dr. Guevara, thank you very much for the education today, the explanation, and for keeping us up and running.
Well, my pleasure.